Namaste to all of you. The intention of this video clip is to make sure that more and more Ayurvedic doctors are encouraged and inspired to have a Rasa Shastra based, fast acting, reliable, proven track record and most importantly safe combination of herbs, kind of same way minerals and metals combinations that can be used even in an ICU setup or to bring very quick, reliable, safe results. This is the objective of making this video. And we have with us Dr. Aswath Rao, who needs no introduction for the Ayurvedic community, being the doctor who has implemented Rasa Shastra medicines in ICU in COVID. And we already have you will see in that video description the link of the webinar that happened in Sitaram Acharya Rasayana on 23rd of January. So I will hand over the further details narration to you.
Namaste everyone. In this short video clip, I would like to share an interesting case scenario. The case being a patient after RTA, he was diagnosed with grade 3 axonal injury. His GCS was very poor. He was not even responsive to pain and he was tracheostomized with Rell's tube. After spending 2.5 months in hospital, he was sent back home with very guarded prognosis. In such a condition, just after 2 weeks of the usage of this Hemagarba and Abragarba Pottali, tracheostomy tube was removed. I mean, he was able to maintain saturation without tracheostomy tube and there was no need of even Rell's tube. I will shortly share the details of the treatment. And in some scenarios, there is a risk of aspiration when we are using some medicines. So we have to be very careful when using the medicines in emergency conditions. The patient will be bedridden. In supine position, we have to definitely raise the position of the patient and then administer these medicines. Just after 2 weeks of use of these medicines, for example, even though these two look similar, this is Hemagarba Pottali and Abragarba Pottali. I gave in a dosage of 1 gram per week. As I mentioned earlier in the previous video clips, if I mean 1 gram per week, I have to use half the medicine in 3-4 days. Every day I had to give half of the dose required to be given for that day. And after I have used, along with these medicines, I have used Brihatva Chintamani Rasa and Chandraprabhavati. So because he was even diabetic, so it will be helpful for his present condition also. After 15 days of these medicines, he used to maintain saturation without oxygen. Even though he had tracheostomy tube, his crepitations and bronchi came down to a very great extent because he was bedridden for 2.5 months. Even he had basal crepitation. He was prone to develop pneumonia anytime. But without the use of antibiotics, his lung pathology improved to a very great extent. And he was maintaining saturation even without oxygen, the use of oxygen concentrator. So tracheostomy tube was removed after 15 days. So they realized his wife was giving tirtha to him from a period of 2.5 months. So it was just a passive process. She used to just pour 2 to 3 drops. His swallowing reflex was totally absent after the incident. And the tirtha simply come out. It was just a satisfaction for her that she has given something. But after 15 days of treatment, to her surprise, he started swallowing the tirtha. So this is a very big surprise for everyone. Even we expected him to improve in a span of 2 to 3 months. But I think as we use this Pottali preparations, we got quick result and even Rell's tube we could remove comfortably. We started him on oral liquids and now he is even taking oral soft diet and even solid diet. And along with this, I would like to tell or share important information regarding the modern parameters that we are using to assess the need for use of emergency medicines. For example, for the same patient, his vitals were not stable. That's what we thought. Sometimes what the patient did was they had a pulse oximeter, even the monitor, which usually regularly electronic monitor, which continuously monitor the blood pressure, etc. Sometimes the patient's attendants used to call me, the BP has dropped to 90/60, or the pulse oximeter sometimes it will show false value, or like it might be 70/80. There are some parameters which might misguide us and compel us to use these emergency medicines. What I am trying to tell is, even though we know the medicines are safe to use, we should not unnecessarily use the medicines. And in this case, and even in our hospital, I have seen in many instances where the electronic monitoring showed blood pressure as low as 90/60. But when we checked with manual blood pressure checking monitors, it was 110/70 or 120/80 normal. So before starting the medicines, I feel it is better to double cross check the present condition of the patient. Or many times the extremities are cold. It might show false low oxygen levels. When you just warm the fingers and check the pulse oximeter, it will be more than 90. Or the person may be having atherosclerotic changes in their arteries, especially in old age individuals. So maybe when we fix it to some other places, it might show a normal oxygen level. At the same time, we should be even unnecessary. We should set the dose according to the condition of the patient. As we know, some of the medicines are very expensive. It does not mean that because the medicines are safe, we can use it to the highest possible dose. Thank you.